Dr. Brian Waters here, Indy Muscle and Joint Clinic again. We're going to do front side of the hip. So just like before on the other hip exercise, I do like to start with that hip stretch on the foam roller, laying on it like we did for the knee. Now this plays into that a little bit more. So we're going to lay on our side with the active or the issue side up. So in this case, I'm going to do my left hip up. And we're going to activate the glute. So we're going to lay up against a wall. We want to have our head supported, so I don't care if it's a foam block, if it's a rolled up towel or something like that. I'm going to bend my bottom leg. I'm going to try to keep my upper body kind of in line, so you're going to have to find spacing. So this should be a straight line. This arm's relaxed, this arm's going to be here, and I'm slight brace, and then breathing through my stomach. That's very important. The tendency is you'll be in this position. I'm going to tell you to drive through your heel, activate your glute. It's going to turn off the hip flexor, so it's going to help balance out the hip. And we're going to hold for a good 30 seconds to a minute. You're going to hold your breath, and that's going to be hard. So I'm activating my glute, pushing through the heel into the wall. This is a straight line. I'm trying to relax my low back. I'm trying to breathe through my stomach, light brace at 30%. Not over brace, just light brace. Be able to breathe through that, and I'm gonna start to feel my glute start to get kind of tight because I'm really using it. Pushing about 50% of my power into the wall, and you're gonna start to get a stretch in the quad. That's the whole point. Activate the glute, it turns off the front of the hip. It has to, like a bicep-tricep relationship. You flex one side, it turns off the other, and the opposite. And relax. So that was about a minute. I really like 3 intervals of a minute hold. In between, you're gonna wanna hang out. I am on a mat. I'm actually on 2 mats. You don't want to get compression on your bursa there. It's going to irritate the opposite hip. So always make sure you're on something. Rubber mat's not good enough. Put like a towel down or a t-shirt, something like that. Something to give you a little bit of a buffer. Again, I'm going to do this 2 more times. Cool?